Instead, we have the opportunity to make a habit of empathy, to recognize ourselves in each other.
Hi, it's Edwin Rutsch from ProgressiveSpirit.com. Barack Obama has repeatedly talked about the importance of empathy in society. Our group is working to help build a culture of empathy. After a series of planning meetings, we held the first in a series of empathy cafes to tell stories about the role empathy can have in reforming healthcare. This video gives an overview and a bit of a flavor of the event. I hope it encourages you to take part in future events.
We're setting up for the Empathy Healthcare Cafe. We have a crew of people that are working really hard setting up the cafe style. So we have a little bit of ambiance. We have flowers on the table, little goodies to nibble on, and I believe we're going to have candlelight too. So we wanted everybody to be comfortable and feel like they can enjoy the evening conversing about. It should be a great evening.
I was drawn tonight because of the innovative method that they're using here, the World Cafe method, a great method to tap into the collective wisdom of any particular group.
Just meet with other people who are thinking about these questions and hearing what they have to say. And I find the whole notion of thinking about empathy in a social and public way extremely interesting.
What Obama thinks about empathy in our country, and so Edwin's put together a nice little collage.
To recognize ourselves in each other.
I call the empathy deficit. It's the inability of people to stand in other folks' shoes.
Why do we need empathy in healthcare? And you may come up with one statement from your whole group, or you might come up, each one of you have a statement.
The loss of empathy and the focusing on the value around acquisition, material acquisition, and in many cases it is about the money.
It's all competition driven. In Holland, France, that's with different languages. I got sick. They said, "There's the doctor. You go to the doctor. You get the thing that it's taken care of." But the system needs to be empathetic, and that'll filter down.
Right now, we've gotten ourselves into such a problem. There's so many health issues that people have because the systems are perpetuating it, on and on.
Are we saying like it's needed in healthcare, or it should be there, or it should be other things, it should be part of other factors?
It should be built into the system.
I think that's the point.
Yeah.
Attention up here, and for those of you that haven't written something yet, you can finish up, and I may just let you speak from your tables.
We're not sure how, but we just think the entire system, because of all the various stresses, is just basically unempathetic right now.
Basically, we were talking about how empathy is natural and it's a foundational value, like how it can operate in healthcare is one expression, but it's a foundational value for all aspects of life, all aspects of our community. Particularly in healthcare, that empathy is natural when someone's in pain to feel for that person. So that it's really about just removing what's unnatural and sort of getting in the way of that empathy.
We did sort of reach a conclusion that in a bureaucracy or in a large system, healthcare, there may be sort of built-in obstacles to empathy.
Well, you're just talking about systems, like where is there a lack of empathy? Is it the insurance company? Is it the hospital? Is it the kind of care that we're providing? Is it the education that our physicians are receiving? Is it kind of, where do you can't really pin it down. It's the whole system.
I want you to let your imaginations go wild. I want the next topic is to come up with actions that we can take to change healthcare to be based on empathy.
What can we do, to make healthcare more empathetic? That's the question. It's the action portion of it,
Wouldn't it be great if there were if each neighborhood really took care of their own neighborhood?
See, I just wrote down call strangers and say, have a nice day.
We have empathy for the nurses that are overworked, and empathy for the front desk people.
Letters are nice too. People get,
Having somebody there that you can go to and say, these people are making my life hell.
Insurance companies could have a patient advocate.
I was thinking of setting a goal of having a certain number of conversations with people in my own personal circle specifically around empathy and then connecting that to healthcare.
Working in a small group that might do something in the world, but also walk its talk within the group itself. And that would be my contribution to a culture of empathy, if I can do it.
But like there was an AIDS quilt for all the people who died of AIDS. You could have something like that of all the people who've suffered or died because they were denied care because they couldn't afford.
Could you imagine that?
Like a square for a square for each story, and it would be gigantic.
Being willing ourselves to accompany our friends when they're in that kind of situation. Or
petitioning Move On to create an ad that has empathy as a core value.
Empathize with doctors or other medical professionals when you encounter them, because they need empathy as much as the patients do.
Share positive empathy stories in healthcare.
When my grandparents were dying, we had them at home, at their home, and there were caregivers who came that would take care of them, help us take care of them, and they just really cared for my grandparents. You know, when my grandparents died, they were personally affected. That's just how they connected with my grandparents.
Wow. I had been talking to this one lady who was in the administration there, and she didn't know that my mother had passed away, and she came up to me in the hall and she says, "Oh, about that point that you were making, we want to take care of that or something." And I said, "Well, it's not necessary anymore." And I didn't have to say anything else, and immediately she says, "I am so sorry." And she broke down and started crying. And it was like, all of a sudden, the hospital was showing some heart, some concern.
I was really amazed by this doctor. Like, she listened.
So I know him, he knows me, and it sort of creates it creates a level of trust.
Like, I love going into Herrick. I mean, they come and valet park me. They've got beautiful flowers, you know.
He never made me feel like, you know, my time was up and I better get going.
I felt vulnerable because I know I need to have a doctor. I need to be paying attention to my health, and at the same time, I don't want to, you know, have this awful experience repeatedly. And I just felt like I was in a, you know, I couldn't figure it out. And I just felt like this doctor got it. And it was just some really simple things. She just listened.
Pick a couple of stories and be able to share it with the whole group.
This is a patient I've had for a couple of years now, and she's actually a good friend of mine now. What she's expressed to me recently was that she's so grateful to have to work with me as her physician, and what I feel inside is that I'm so grateful to have her as my patient, and so I just wanted to share that.
If anyone is interested in joining our Empathy Action Group or working on the documentary, get in touch with us.
I wasn't exactly sure what to expect from, you know, the title Empathy Cafe. I thought it'd be really like touchy-feely, kind of, you know, very Berkeley, and so I was very hesitant to come, but actually it turned out to be, you know, lots of good concrete ideas on how to improve the system and how to do it by creating more empathy.
Yeah, I enjoyed hearing watching the videos and then hearing everybody's perspective on empathy. And I think it's a good thing to bring people together and have dialogue about empathy.
That's what I take away from here. I take away, I really need to think about this subject matter.
I was surprised how excited I got when we started brainstorming the grassroots things that we could actually do, or the ideas that we could spark.
I'm just pleased to see so many different types of people here, and I thought that it was really exciting for me at the end of it to feel motivated to do something. So whatever we did here tonight felt like it sparked a real energy in me to move forward in this, and that feels really important. So.